I'm Diana Davis, and I will be doing my presentation on Bordetella pertussis. Bordetella pertussis is a gram-negative coccobacillus organism. It's more commonly known as whooping cough, and it is usually transferred by sneezing and coughing from respiratory droplets. People most susceptible to this disease are infants and the elderly and people who are immunocompromised, like somebody undergoing chemotherapy. B. pertussis is gram-negative and a coccobacillus, just as I said before. It can be cultured in either TSA sheep's blood agar or in blood charcoal agar. This picture right here is the TSA sheep's blood agar. And in the TSA blood agar, it is usually small, white, ovoid, and where the swab was, they're pretty clustered together, and then here there's a few little separated colonies. And the colonies are raised within an entire edge appearance. So this picture is of the pertussis in the charcoal blood agar. That's why it's black in the background. And pertussis is an obligate aerobe, meaning it needs oxygen to stay alive. And it normally is incubated at around 35 to 37 degrees Celsius. And in humans, our body temperature is 98.6 degrees Celsius, 98.6 degrees Fahrenheit, or 37 degrees Celsius. So this bacteria really thrives in humans because we have a lot of oxygen and we're at the perfect temperature for this to incubate and survive. So there are also different types of the pertussis strain, I guess. There's Bordetella pertussis, which is up here, which you've seen before, and then there's also Bordetella Pertussis. They both cause very similar side effects and symptoms in humans, but B. pertussis is a lot harder to get rid of than B. parapertussis. And up here, is B. pertussis, and here is B. parapertussis, and you can kind of tell the difference with the discoloration, how this one is more yellow and this one's more black and purple, and their borders are much more irregular on the B. parapertussis versus the B. pertussis. And the B. pertussis bacteria attacks a host by getting into our airway and paralyzing and killing the cilia in our lungs. And the cilia are meant to move around and get rid of any kind of debris or pathogens or dust and things that we just naturally breathe in. And so when the cilia aren't working, they can't do their job, and that causes coughing and other issues. So the bacteria, like I said before, they paralyze the cilia, and they also inject toxins into the cells. So some of them are the pertussis toxin and the dermonecrotic toxin and the tracheal cytotoxin. And the dermonecrotic toxin is what actually kills the cells in our trachea and in our lungs. So the cells enter our respiratory system by rearranging the cytoskeleton in the healthy cells and make it easier for them to just get right in there and infect them. So the B. pertussis infects all the cells in the respiratory tract, and especially the immune system's T cells, because those are primarily what is meant to kill this infection. It usually begins in the trachea because that's closest to where our airway starts, and then it makes its way down into the lungs and to the alveolar sacs. When it gets to the alveolar sacs, that gets pretty dangerous because that's where O2 and CO2 are exchanged. So that could be really bad, especially when liquid and other nasty things get in there, and that's when you get things like pneumonia and other diseases. There are 3 stages of pertussis, and they each have different symptoms. So the first stage is the catarrhal stage. This is when the host becomes infected, and they aren't really showing outward signs like the whooping cough hasn't occurred yet. They have, runny nose, low-grade fever. They're coughing a little bit, not a ton. Infants and children often experience apnea, which is a pause in breathing, and that can be really scary and really dangerous because they need oxygen. And this usually lasts around 1 to 2 weeks. And then the paroxysmal stage starts, which is when the whooping cough begins. And the really intense fits of coughing. Some of the side effects from the coughing are tiredness, vomiting, eye bulging, facial discoloration, and cyanosis of the lips and nail beds, which is when your lips and your nail beds, they turn blue, meaning you're not getting enough oxygen. And then after the coughing, the whoop sounds are heard because it's a very sharp and deep inhalation of air, trying to get that back in the body. And this stage can last anywhere from 1 to 10 weeks. And finally, the convalescent stage is when the coughing fits kind of become lesser until you're fully healed. But this is a time when you are especially susceptible to things like bronchitis and pneumonia and other respiratory illnesses. And this usually lasts 2 to 3 weeks. Here is a timeline of infection. So 5 to 10 days up to 21 days is when incubation is. So you're not exhibiting any outward signs. It's just kind of brewing. And then the catarrhal stage starts, and that's 1 to 2 weeks. The paroxysmal stage is right here for 1 to 6 weeks, it says on here, but it could be up to 10 weeks. And then finally the convalescent stage, which could be weeks to months. So when the immune system senses that the B. pertussis bacteria is in our bodies, the first thing it does is mass phagocytosis of all of those infected cells to try and kill it from the start and not get anything else infected. But once that's no longer an option and once it's not beneficial, the body sends in lots of different cells to kill this bacteria, things like macrophages and neutrophils and killer cells and T cells. And T cells are the primary things that want to kill this bacteria, but the bacteria also attack the T cells as well. So, and they also kill cells that have the toxins in them themselves, but maybe not necessarily the bacteria. So, and there are lots of different things that we have developed to prevent or stop this infection from spreading. There are 2 types of vaccines that we can have. There is the DTaP and the Tdap. So the DTaP vaccine is the one that you get first, and it's for infants and children under 7. And the Tdap is for preteens, teens, and adults, and it needs to be re-administered every 10 years. And even though no vaccine is 100% effective, even if you get pertussis and you've been vaccinated, you won't get as sick as you would without the vaccine. So according to the CDC, there is a schedule for the DTaP vaccines, and you get them at 2 months old, 4 months old, 6 months old, 15 to 18 months, 4 to 6 years, and then once you are anywhere from 14 to 16, you will start your Tdap vaccines every 10 years. So half of children younger than 1 who contract pertussis, they actually end up in the hospital. And that's why it's important for parents and grandparents and older siblings to make sure they're up to date on not only their pertussis, but all of their vaccines before they're in close contact with infants. It's our job as responsible adults to make sure that we're protecting people who can't be vaccinated. And even though as adults, pertussis is not necessarily life-threatening, it's very dangerous, especially for young children who don't have that ability to fight off that infection. There are also 2 other forms of the vaccine that can be given. There's the whole cell vaccine, which has the actual inactive pertussis cells in them. And this one can be mixed with other vaccines like the diphtheria and the tetanus. So that's normally what we get because they're all mixed together and it's, 3 in 1. So it's easier. It's also cheaper, but the more of the whole cell vaccines you get, the more side effects and swelling and redness and things like that will occur. So as a response to try and help this, the acellular version was created, which has, it doesn't have the full bacteria in it. It only has components of it, like the toxins and some of its like physical parts, like the strands and things like that. So both types of vaccines have similar success rates, but like I said before, most people use the whole cell ones in developed countries at least. And in addition to preventing pertussis, if somebody has been infected with it already, you can be given antibiotics like azithromycin or erythromycin with the onset of the illness. And finally, some unique characteristics of this microbe. Although it's a bacteria, it acts a lot like a virus with its ability to persist and survive within the respiratory tract. It's very, very hard to get rid of, and it takes a lot of effort. And pertussis can also trigger other systemic events that can kill someone, like seizures or organ or brain damage from a prolonged lack of oxygen. And the bacteria also is very good at resisting the body's immune responses to eradicate the bacteria, especially by killing all of those T cells. So that is everything I have on Bordetella pertussis.